Thank you for attending Hopkinsville Community College's pre-admission conference. Please listen to the entire presentation and follow the instructions along the way. My name is Joyce Lambrino, and I'm the Nursing Programs Coordinator. If you continue to have questions after this presentation, please contact my administrative assistant, Ms. Kristen Martin. It is preferred that you contact her via email at kmartin0238@kctcs.edu. Ms. Julie Foles is a medical assistant coordinator. If you have questions about that program, you may contact her as well. If you prefer to call or stop by, our address and phone number is listed below. There are a couple different opportunities for you in nursing here at HCC. We have the Associates in Applied Science of Nursing, also known as the RN program. We have Practical Nursing, which is the PN, and then we have Medical Assisting through the Allied Health Division. You may enter the RN program via 3 different pathways. The traditional, transition to medic to RN if you're a military medic, and in the LPN to RN bridge. Let's talk about each of those. The Associate Degree Nursing Program is approved by the Kentucky Board of Nursing and accredited by the Accreditation Commission for Education in Nursing, also known as ACEN. The Practical Nursing Program is also approved by the Kentucky Board of Nursing. And effective February 20th, 2024, the PM program is a candidate for its initial accreditation by the Accreditation Commission for Education in Nursing. This candidacy status will expire February 20th, 2026. The technical competencies for the associate degree in nursing. Upon completion of the program, the graduate can advocate for patients and families in ways that promote their self-determination, integrity, and ongoing growth as human beings. They can formulate judgment and practice, substantiated with evidence that integrate nursing science in the provision of safe, quality care, and promote the health of the patients within the family and community context. They can develop one's role as a nurse in ways that reflect integrity, responsibility, ethical practice, and an evolving identity as a nurse committed to evidence-based practice, caring, advocacy, and safe quality care for diverse patients within the family and community context. And 4, they can consider the evidence that underlies clinical nursing practice to challenge the status quo, question underlying assumptions, and offer new insights to improve the quality of care for patients, families, and communities. RN General Education courses. The prerequisites that must be completed prior to admission include Bio 137, Anatomy and Physiology 1. A quantitative reasoning that is aligned with the Associates in Science or Associates in Arts degree. The nursing faculty recommend MAT 150, College Algebra. That sets you up to be better prepared for you continuing your education after you leave HCC to obtain your bachelor's degree. PSY 110, General Psychology, NAA 100, and it is the Nursing Assistant Skills or Nurse Aid, and you must be on the state registry to meet the requirements for admission. Sometimes it takes a little bit to get a test date and to be on the registry, so try to do that as soon as possible after you take the class. And then current CPR through American Heart Association and we do not offer or accept Red Cross. So it must be through American Heart for the healthcare professional. And then to be completed as pre or co-requisites after admission is Bio 139, Anatomy and Physiology 2, and it's a pre or co-requisite to Nursing 101, first semester. ENG 101, Writing 1 is a pre or co-requisite to NSG 219, NSG 195, or NSG 209. Bio 225 is Medical Micro, and it's a pre or co-requisite for NSG 229 third semester. And then you have Heritage or Humanities. Take your choice. There's a variety that you have to choose from that HCC offers, and it is a pre or co-requisite to NSG 239.
Okay, now let's talk about each of the programs. We're going to start off with the associate degree. It prepares students and graduates to use their skill and knowledge to fulfill the role of a nurse. Graduates are eligible to sit for the NCLEX RN in order to become a registered nurse. It is 4 semesters long, 2 years in total. That's spring and fall semesters with no summers. This route admits students twice a year, fall and spring, and each of the courses must be taken in this particular sequence. First semester includes Nursing 101, Nursing Practice 1. Second semester is Nursing 219, Med Surg 1. Nursing 212, Behavior Health. And in third semester, there's 2 courses, Nursing 229, which is Med Surg 2, Nursing 211, which is Maternal Newborn Nursing. And in the last but not least semester is Nursing 239, Med Surg 3, and you take it along with Nursing 213, which is Pediatrics. The LPN to RN Bridge program is for licensed practical nurses, and they can be awarded advanced placement option into second semester. This associate degree nursing pathway is 3 semesters long, fall and spring with no summer sessions. The nursing courses must be taken in a particular sequence, which include, for first semester, it's NSG 195, Transition to ADN, Med Surg 1, NSG 212, which is Behavioral Health Nursing. Second semester would be NSG 229, Medical Surgical Nursing 2, NSG 211, Maternal Newborn Nursing, and in the last semester would be NSG 239, Medical Surgical Nursing 3, and NSG 213, Pediatric Nursing. Next, we have the transition Medic to RN pathway. A military level 10 medic with a MOS of 68W and documentation of honorable discharge may be awarded credit for prior learning. Students must meet all other nursing admission criteria to be accepted into the program for credit to be awarded. It is 4 semesters long, 2 years in total, spring and fall with no summers. The nursing courses that are to be taken in this particular sequence include, in the first semester, it's NSG 109, Medic to ADN 1. Second semester, it's NSG 209, Medic to ADN 2. Along with that, in second semester, you will have NSG 212, Behavior Health. And then the remaining 2 semesters are the same as the traditional I just spoke about on the previous slide. Okay, now we're going to switch gears a little bit and talk about the Practical Nursing Diploma program. It prepares students to sit for the NCLEX PN in order to practice as a licensed practical nurse. They are an integral part of the healthcare system, and they practice under the direction of a registered nurse or a physician.
The PN program student learning outcomes. Following completion of the practical nursing program, the graduate will be able to promote the human dignity, integrity, self-determination, and personal growth of patients, oneself, and members of the healthcare team. They will be able to provide a rationale for judgments used in the provision of safe, quality care, and for decisions that promote the health of patients within the family context. The graduate will be able to assess how one's personal strengths and values affect one's identity as a nurse and one's contributions as a member of the healthcare team. And 4, the graduate will question the basis of nursing actions, considering research, evidence, tradition, and patient's preference. PN general education courses. Prerequisites to be completed prior to admission include Bio 137 Anatomy and Physiology 1 or Bio 135 Basic Anatomy and Physiology. AHS 115 or CLA 131 Medical Terminology. ENG 101 Writing 1 and AA 100 Nursing Assistant Skills, and you must be on the state registry after you take that course, along with current American Heart Association Basic Life Support BLS CPR, which is offered at HCC. It's CPR for healthcare professionals. You must be certified with American Heart. We do not accept American Red Cross. And then to be completed as a pre or co-requisite after admission is Bio 139 Anatomy and Physiology 2, which is a pre or co-requisite of NPN 106. If you took Bio 137, taking 135, you only need to take Bio 135. You do not need to take an additional bio class. Our practical nursing program is 3 semesters long. We admit students in August, and they complete the program in July. In the fall of each year, we offer fundamentals of nursing, nursing pharmacology, and mental health. Those are prerequisites to the spring semester, which we offer Med-Surg Nursing 1, Childbearing Family, and Medical Surgical Nursing 2. These courses are prerequisites to the summer, 3rd semester, Practicum and Nursing Leadership and Management. Requirements and deadlines checklist. The following requirements must be met by 4:30 p.m. on May 15th for fall admission or October 30th for spring admission. First, you must attend a pre-admission conference, and congratulations, you're doing that right now. You must submit an application to Hopkinsville Community College. You must submit an application to the nursing department, and instructions on how to do that will be at the end of this presentation. You must submit your high school transcripts or GED scores to the admissions office. Submit official college transcripts to the registrar to be evaluated. Transition medics to RN applicants need to provide supporting document for their 68W by providing an ERB, ORB, or DD-214 with your military verification form, and you can get that form from the nursing department. LPN to RN bridge applicants need to have completed the prerequisites and first semester co-requisites. They must have an unencumbered active LPN license and submit a verification of employment form, and that can be obtained by the nursing department as well. And then you must take the NLN entrance exams, and those scores requirements will be discussed on the next slide. The NLN NEX or NACE exams are required for entrance. For the RN traditional transition, a PACS composite score of a 111 is still accepted, even though that exam is no longer being offered. The new exam is a NEX, and the composite score required for entrance is a 149 or greater. For the PNs, a PACS composite score of a 99 or greater, or a NEX composite score of an 88 or greater. The LPN to RN bridge students are required to take the NACE, and that percentage score of a 76 is recommended. The NLN, NEX, and NACE pre-admission exams are offered in person at HCC's Workforce Assessment Center in remote online formats. Please visit www.nlntest.org to set up an account with NLN and schedule your exam. NLN has provided a study guide to help you with the registration process, and it can be accessed by the link below. Once you have set up your account on www.nlntest.org, follow the steps in the NLN Student Guide. You want to select Register for Exam for the in-person exam. Type in Hopkinsville in the site field and leave the other fields blank. Then you want to select the appropriate available exam date for the NEX or NACE. For remote proctored exams, you should go to Buy Exams and select NEX Nursing Entrance Exam for the NEX or the FN 1.2 for the NACE.
Okay, additional information regarding prerequisites and deadlines. All prerequisites must be completed by the end of summer session for fall admission and the end of fall semester for spring admission. You must have active status on the Nurse Aid Registry. Please remember that once you take the course, it sometimes takes up to 30 days after the exam date to be on the registry. So, you must be on the registry by the end of the summer term, but it varies around August the 1st for fall admission and by December 31st for spring admission. Another requirement is that you must have an overall GPA of a 2.0 prior to coming into the program, and you must maintain that throughout the program. So that means you must earn a minimum of a C in all your math, science, and prerequisite courses, along with your nursing courses, in order to move forward in our curriculum. If you earn a D, you will be dismissed from the program. And our minimum C score is a 75.
Selective admission. The Nursing Admissions Committee meets after each application deadline. Classes are chosen from the top NLN scores of the completed files received. Nursing Admissions Committees normally recommend to admit up to 40 applicants for the RN program, and that's the traditional and transition, up to 15 applicants for the bridge program, and up to 35 applicants for the PN program. Nursing admissions procedures. Decision letters will be sent via mail 30 days after the application deadline. A waiting list may also be selected by the committee. If a tie occurs in the NLN exam scores, the GPA of the prerequisite courses will be the tiebreaker. Information will not be available by phone regarding the admission status or the wait list. Notification will be sent out in writing. Acceptance letters will include instructions for you to provide documentation for specific lab test results. proof of health insurance, and proof of immunity such as hepatitis B, tetanus, and other immunizations. You must show proof of current CPR certification for the BLS healthcare provider by the American Heart Association. Please be aware that some immunization processes take months to complete, so plan ahead. Not having them by the set deadlines may cause you to lose your seat into the program. Criminal background checks and drug screens. Criminal background checks and drug screens are done prior to the start of the program, and they must meet clinical facility guidelines. The clinical facility has the say-so to whom can come into the healthcare facility as our regulatory agencies require. If the facility says a person with a background check issue cannot come into the facility, then the student will not be able to continue in the program. Drug screens are required annually at a specific contracted lab. If you are asked by a facility or an instructor to submit an additional drug screen, then that would be required and it would be at the student's expense. Information on how to obtain the background checks and drug screens will be sent to the applicants who are accepted into the program.
Students that have been convicted of a felony or misdemeanor must submit documentation to the State Board of Nursing prior to graduation, or preferably even before starting the nursing program. FBI checks are done prior for you sitting for the NCLEX and processing your application for licensure. The State Board of Nursing can deny you license to practice for certain convictions. So there has been times to where a student has gone through the program where the clinical facility will allow you with your convictions on your background check, but the Board of Nursing does not approve of those convictions for you to practice as a registered nurse or a licensed practical nurse. So if you've got something on your background check, I would recommend that you try to have it expunged or at least be open with the Board of Nursing and explain your situation, and they may permit you to apply for license or take the NCLEX. You can apply anytime you want to. Nursing can be very strenuous physically and mentally. So you must verify that you possess the following in order to provide safe and quality patient care. You must be able to see accurately because you have to measure medicines and that sort of thing. You must be able to hear adequately in order to hear beepers and IV pumps and patients yelling and that sort of thing. You must be able to have fine, gross motor skills in order to perform certain duties and procedures. You must be able to communicate effectively. You must have intellectual ability, emotional stability, because it can get very emotional when a patient dies or is upset. You must be able to lift or move at least 50 pounds and stand or walk for at least 12 hours a day. If you are unable to do any of these things, you may want to reconsider your nursing profession and possibly speak to an advisor to talk it out for their advice. Now, we have a reapplication process for those that have tried once or twice or even 3 times and have not been able to get into the program. If that has happened to you and you want to reapply, you must attend another pre-admission conference for the semester in which you are applying, whether it's live or online, in order to reactivate your file. You must submit a new application according to the instructions that you receive at the conference, and you must also meet any new deadlines for that semester, including meeting all criteria that may have changed since your previous application. Every once in a while, we have a transfer student from another nursing program. Those students must meet all other nursing admission requirements that I've already talked about with traditional students, plus quite a bit more. You must submit a letter to me stating your desire of admission and reason for transfer. You must submit course documents from your previous school that you're wanting transferred into HCC. A faculty member from your previous school must submit a letter of recommendation. Acceptance as a transfer student will depend upon space availability. It's not guaranteed. And then you must also pass the final exam for the prior med-surg course and check off on skills from your previous course. The final exam, for example, the final exam from fundamentals must be taken in order to transfer into second semester. If you've got questions about this, because it can seem a little complicated, don't hesitate to contact Ms. Christie, and she will set up an appointment with the nursing advisor to clarify these for you. And another thing, if it's been longer than 3 years since you've started your first course in a nursing program, you must start over from the beginning at HCC. This slide is just basically an estimated expense, excluding tuition. Tuition's not on here, it's the same for everybody. So you can figure that out. However, it does have different things on here, such as liability insurance. You pay that. That's actually added to your tuition. You've got uniforms, books, travel, background checks, drug screens, memberships, blood tests. All of this may vary. It's got travel in there. You know, if you live across the street from the college, it's not going to cost you $200. But if you live off of exit 12, down off of 24, it may cost you more than $200 per year. But it is divided up into program. The PM program is all listed there as one. Then you've got the RN first semester, RN second semester, or second year, and then you've got the medical assisting. So the estimated cost is about the same for all of them, but they do vary according to programs just a little. The college does follow the Americans with Disability Act. Any disability that is covered under the ADA should be reported to the Student Affairs Office. That number is 270-707-3801. Any student who has a documented disability meeting ADA accommodations must contact the Chief Student Affairs Officer to develop a plan prior to the beginning of the semester. Don't like to do it in the middle, it just causes chaos. So, if the nursing department receives a notification of a plan, we determine if the request of accommodations can be met. We do this periodically, but there are some times that we have to deny those accommodations according to the safety practices I just spoke of on the previous slide.
The nursing programs are very vigorous and intense, and you must be prepared to make the commitment and sacrifices to be successful. Organization and undisturbed study time daily is a must. Support from home is important. Working, time management, child care, and family issues, as well as financial concerns, are all things that can be your demise in the program. If you work, we recommend not working any more than 20 hours a week. If we find that if you work more than that, it can interfere in your study time too much. So you must have a good plan and be determined to put in the time and effort it takes to be successful. Finally, please type the web address below into your browser to complete the conference in your application. I want to thank you for choosing HCC, and I hope to see you soon.